Hi, good morning to everyone. My name is Myra Florlava, and I will be discussing with you today about birth injuries. Specifically, my objective is that at the end of this lecture, the students will be able to discuss birth injuries of the newborn and their management. These birth injuries include caput succedaneum encephalhematoma, facial paralysis, Erb's palsy, and fracture of the clavicle. Now let me go through these disorders one by one. Birth injuries are physical injuries referring to the damage of tissues and organs of a newly delivered child, often as a result of physical pressure or trauma during childbirth. According to Alexander J.M., the reported incidence of birth injuries is higher in singleton vaginal deliveries of fetuses, even in cephalic position, which is about 2%, and only 1.1% in cesarean deliveries. According to Papanagbato, by identification of high-risk deliveries through the use of fetal and perinatal ultrasound prior to labor, the use of less harmful obstetrical instruments other than vacuum and forceps and techniques and cesarean sections are becoming more and more acceptable. Okay, birth injuries commonly occur in preterm and small for gestational age babies. Why? Because of their very delicate and fragile body parts. Also in difficult vacuum and forceps deliveries. Now these are instruments being used for assisted deliveries. Okay, for indications such as when there's a delay in the second stage of more than an hour in primigravida and 30 minutes in a multigravida, when there is a need to reduce maternal effort if a mother has cardiac failure or gestation hypertension, and thus there was the giving of epidural anesthesia, and also to minimize the strain on a scarred uterus. Okay, then bridge delivery. Bridge delivery, this is instead of a head-down position when the buttocks or the presenting part. Precipitate labor is when it just took less than 3 hours for the delivery of the baby. And shoulder dystocia, this is the arrest of the anterior shoulder of the infant after the delivery of the head. And this usually occurs in large babies. Let me start with caput succedaneum. Caput is an edema or swelling under the skin, but above the periosteum of the skull. What's periosteum? It's the membrane that covers the outer surface of the skull, at the presenting part of the head, usually the occipital area during delivery. And this caput crosses the suture line. What do I mean by this? Suture lines are anatomical lines where bony plates of the skull are joined together. So this is one bony plate which is called the parietal bone, another side of the parietal bone, and when they are joined together, they create the suture line. Okay? Now this is the caput or the swelling or this presence of edema. Since it is located above the periosteum, there's a tendency of this to become diffused or scattered, and so it crosses the suture line. Now, for the treatment, caput gradually absorbs and disappears at about third day of life. So no cause for worry for the parents because it needs some treatment and resolves by itself. Hematoma. Cephalhematoma is an effusion of blood under the periosteum that covers the skull bones. Okay? Unlike caput, which is above the periosteum, cephalhematoma is under. And it is caused by friction between the fetal skull and maternal pelvic bone. And this may occur because of frequent and continued pushing effort of the mother. It can also be caused by the use of vacuum for vacuum extraction. Okay, as I've said, this is the type of assisted delivery where the vacuum is placed on the fetal scalp in order to pull the baby out. Now, swelling appears 12 hours after birth and can persist for weeks. Another thing that we should take note here is that it cannot cross the suture line. Okay, so if we are going to compare cephalhematoma with caput succedaneum, it's a lot different. One, there's the effusion of blood for cephalhematoma, for caput, edema or fluid. And caput, it is located above the periosteum, cephalhematoma under the periosteum. Caput, it appears during the delivery of the baby and disappears on the third day of life. Cephalhematoma, swelling appears about 12 hours or even it will take around 2 days. And it may persist for weeks. Another difference is that caput crosses the suture line, cephalhematoma does not cross the suture line. Okay? But the same with caput, cephalhematoma needs no treatment. Alright. Now the reason there is this effusion of blood, because this is actually ruptured capillary, okay, in the periosteum of the skull. And since it's in the periosteum or under the periosteum, there is no crossing on the suture line. My first question based on the earlier discussed topic. So this is question number 1, and let me read through it. You are examining the head shape of a newborn. The doctor mentioned he has caput succedaneum. Which of the following should you observe in the baby? A. Diffuse edema of soft scalp tissue that crosses suture line. B. Hematoma between periosteum and skull bone, unilateral and does not cross suture line. C. Muscle twitching, seizures, cyanosis, abnormal breathing, and shrill cry. D. Head large compared to chest, small fontanelles, hair-like matted wool. Okay, now let me see. Who among you are saying A? Who are saying B? Raise your hands. Letter C. And what about letter D? Okay, now let's find out the answer. So if the doctor mentioned that the baby has caput succedaneum, you are correct when you expect that your observation would show letter A, yes, diffuse edema of soft scalp tissue that crosses suture line. There you have it. I have given you the lecture for cephalhematoma and caput succedaneum, and I do hope you have understood my lecture.